Hello, I'm Brian Johnson. I'm an emergency room physician, and today we're going to use the Clarius PAL ultrasound probe to identify the subclavian landmarks for a subclavian central line. Typically, we don't do many subclavian lines. We do internal jugular, central lines, and femoral lines. But it's good to have in your armamentarium how to perform a subclavian central line. And with ultrasound, it improves your accuracy and minimizes your complications. And so we'll demonstrate where to approach the subclavian, both in the infraclavicular and the superclavicular approach. I'll demonstrate both of them. So typically you have it in venous setting, which is a good setting on the Clarius PAL, and the patient supine, and typically we're going to do the right subclavian if we can. So for the first one, the infraclavicular approach, we're going to kind of put the probe typically near the sternal notch and just below the clavicle, and identify landmarks. You'll see rib and lung sliding. Slowly move lateral and rock the probe back and forth until you identify the pertinent structures, most notably the subclavian vein. Typically, the subclavian artery is deeper. And what you want to do is identify where the subclavian vein joins with the axillary vein, and that's what you'll cannulate for a central line. Now, this should be performed in the long axis. So rotating your probe 90 degrees and rocking back and forth until you identify the subclavian vein in long axis, such as this. You'll see below it is the subclavian artery, and the subclavian vein is what you see on view right now. You would sterilize and cannulate as you would do a normal central line. So that's the infraclavicular approach. The superclavicular approach is where you're getting into the subclavian above the clavicle. Now, the internal jugular vein actually joins with the subclavian vein, and that's where you're actually going to do your superclavicular subclavian approach. What I do is typically place the probe over the right side of the neck. And what I do is I identify the internal jugular vein, which is sometimes triangular. This is a little more anterior lateral from the carotid and is easily compressible like so. And what I do is I follow that internal jugular down. You'll see the subclavian artery below it. See how pulsatile it is on longitudinal view? And above it is the internal jugular. Once again, the internal jugular joins with the subclavian as so. Do you see that? Internal jugular, subclavian vein. And this is where you're going to cannulate for your central line. You'll go once again in long axis approach using sterile precautions and standard Seldinger technique. So, using ultrasound, you can perform a subclavian central line with better accuracy and minimize your complications. Thank you.